Thanks so much for joining us here today to share on breast health, in particular mammograms for those with implants and dense breast tissue, is Dr. Denise Reddy, breast radiologist with Banner MD Anderson Cancer Center. Doctor, thanks so much for being with us.
Thank you for having me.
First off, doctor, how do breast plants change the way mammogram screenings occur, if at all?
So because the x-rays can't go through the implant, we need to do some extra pictures. So what we need to do are what are called pushback views. So we push the implant back and pull the tissue forward so that we can see more of the breast.
So, doctor, are there possibilities that breast implants, could be damaged with mammograms? Can that happen?
That's a good question, and I know a lot of women are concerned about that. The chance of rupture is extremely small, and the benefits of getting a mammogram and detecting the cancer early far outweigh any of the risks associated with getting a mammogram.
Okay, good to know. So let's talk about breast density. First off, what does that mean, and why do doctors talk about it? Why is it important?
Good question. So breast density refers to how your breast looks on a mammogram. It's not how it feels. And basically, every breast has dense tissue, which is white, and fatty tissue, which is more gray. And the reason we pay attention to it is because a cancer also looks white on a mammogram. So when there's a lot of dense tissue, it limits the sensitivity of the mammogram because that dense tissue can hide a cancer.
Okay, so doctor, let's move over to screening guidelines for mammograms. Do those change for patients with implants or patients who have higher breast density?
So the recommendation is for all women, whether you have dense breasts, whether you have implants, that you should get a mammogram every year beginning at the age of 40.
So, okay, good to know, of course, great information. Let's talk about the safety during this time. I'm sure you've received this question a lot. How safe is it to get a mammogram right now during COVID-19?
So we are doing everything we can to help patients feel safe. Patients wear a mask, all the medical staff wears a mask. We've spaced out appointments so that the waiting rooms don't get crowded. We're cleaning off all equipment, pens, pencils, anything that a patient would come into contact with. So that our goal is that women don't defer getting their screening and mammograms because the consequences of not getting a mammogram and waiting too long are too great.
Yeah, absolutely. Great information, doctor. Of course, always in good hands with Banner MD Anderson. Thank you so much, Dr. Reddy, for joining us today.
And thank you for having me.
And thank you so much for watching, and we'll see you next time.